Hey everybody, it's Dr. Jason. Yesterday I promised to talk about the #1 cause of all chronic degenerative disease, and it is the cause, but it's also the result of the things we've been talking about: food sensitivities, nutritional deficiencies, and toxicity. And I'm talking, of course, about inflammation. So why is this so important? All right? Big topic in research today. Incredibly important when it comes to weight loss, but for other things as well. In the literature, inflammation is talked about as a raging fire, right? We have to cool the inflammation in our body. It sounds pretty bad. But what surprises people is that inflammation is actually good. It's a beneficial thing until, right? Until it becomes out of control. So temporary inflammation is good, but chronic inflammation, when it doesn't go away, that's bad. So today I just want to give you a great working definition. The best definition I know of inflammation, which is simply, hey, your body's natural response to an injury. Yeah, it's your body. It's your body's immune system responding on purpose to help you heal. At least it starts out that way. It's simply your body's response to an injury. Now maybe a deeper, more accurate definition is that it's an intelligent healing response, right? Let me give you some examples. You get bit by a bug, a mosquito. That's happened to everyone. You get bit more severely by an animal or a dog. When you sprain your ankle, you hurt your knee or your shoulder playing sports. When a virus or a bacteria or a parasite infects your body, in all these cases, is there a response by your immune system? Of course. Your body responds to being bitten or burned or a bone being broken. What exactly is the purposeful response? What is that? Well, in medical school, they learn, the doctors, the 5 signs of inflammation. I'm about to give you at least the first 4, but it's the 5th one. I'll give you that one too, but that's the most important. So, when we're injured, a bug bite, or a burn, or a fever, or a fracture, #1, R, stands for redness. Now what is that, guys? Blood doesn't come from the universe into the site of injury, right? But upon injury, the intelligent, natural response of the body is to what? Dilate the blood vessels, expand the blood vessels in the capillaries at the sign of injury. But why? Why does that happen? We don't consciously control this, right? It's automatically done. When our blood vessels dilate, the more blood can go to that site, right? More oxygen can go there, more nutrients, and also more waste product can be carried away, right? That's smart. #2, S stands for swelling. We get burned in a fire. A blister forms. What is that? That's the immune system, right? Going in there to take all that damaged tissue away. The white blood cells, the lymphatic system, that's the sewerage system of our body. So the worst thing we can do, which is what we do, is we go in and we start popping the blisters around. You'll notice most of the injuries I told you about so far also always have the 3rd sign of inflammation, which is heat. But why does that happen, right? Why does that happen? When we get sick or injured, the immune system, which is under the control of the brain, it naturally increases our temperature because that's how we better fight off bacteria. It's our body, right, trying to cook and kill anything that's trying to infect us, right? The body can do all of this, but why does there have to be the 4th one, pain, right? Redness, swelling, heat, but why pain? Because without pain, you'd stick your hand in the fire and keep it there. You'd hurt yourself on the tennis court and stay on the tennis court as you continue to make it worse. So now up to this point, these 4 things, which are always uncomfortable and inconvenient, but they're necessary, right? They're an intelligent response to being hurt. But the most important one, the 5th one, is the one people forget. Loss of function. In other words, hey, redness and swelling and pain and heat. But you know what? I can't use my hand anymore if I injure it. That's on the outside. But I want you to think about loss of function in your brain. That's dementia. That's cognitive decline. That's Alzheimer's. Inflammation or loss of function in the breast, that's breast cancer. In the heart, that's cardiovascular disease, right? That's heart disease. That's why we say inflammation, not when it's acute, when it's doing its healing job, but when it's chronic, when it doesn't go away. That's why we say inflammation is considered the cause of all chronic degenerative disease. So tomorrow, I'll be talking about this transition. How does something good become bad, right? What's the mechanism there? So stay tuned for that. I hope you learned something today, guys. Hey, please make a comment, ask any questions. If you'd like to reach out, right, take advantage of our free consultations, you can reach the office directly at 973-376-8383, right? Or you can, you know what, just put yes in the comments section below and we'll reach out to you. We'll show you how to make that possible. Share this video with people you care about. And again, stay tuned for that video tomorrow. Appreciate you listening, and bye-bye for now.